At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family. Greetings and welcome to our latest Let's Talk Your Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS, thank you for joining us. It's a fundamental fact. The better your health is, the better your overall quality of life will be. So it's important to make your physical and mental health a top priority so you can reap the lifelong benefits it brings. So to help Valley residents prioritize their health, South Texas Health System hosts these monthly Let's Talk Your Health webinars to raise awareness of health issues affecting people in the Rio Grande Valley and offer important education and insights that can help prevent, manage, and delay them. In this installment, we'll be talking about thyroid health. The thyroid affects a person's mind, body, and function in many ways. The gland plays a crucial role in regulating metabolism, energy levels, and overall well-being by producing hormones that influence the body's various functions. In the U.S., an estimated 20 million Americans have some form of thyroid disease per the American Thyroid Association, with 60% of those unaware of their condition. So who is most at risk for thyroid issues? What are common signs and symptoms that you may have thyroid problems, and how are they treated? Well, today we're joined by Dr. Stephanie Valco, an internal medicine resident with the STHS GME Consortium, with those answers and more. Dr. Valco, thank you so much for joining us.
Thank you, Tom. Thank you for having me.
Now let's talk a little bit about your first rotation was with a clinic right here in the Valley, which was the Valley Diabetes and Endocrinology Comprehensive Clinic. So you saw a lot of thyroid issues, is that right?
Yeah, that's correct, Tom. So while I was rotating with Dr. Gina Cepeda, we saw a lot of pathology with the thyroid, and many people that, either the thyroid issue wasn't treated correctly or they didn't look for medical attention right away, and then we were trying to help them as best as we can, and then do different tests that we have to do and then treat them on the right direction.
Mm-hmm. Now, when it comes to the thyroid, obviously 20 million people have it here in this country, 60% unaware they have it. Do you feel that that is very similar here, where people don't know they have thyroid issues until they come and see a specialist like the ones at your office that were there originally?
Well, interesting enough, sometimes what happens is that when your primary care doctor orders tests, many doctors order to see how is your thyroid function. And that's the first time that people hear that, oh, something is going on. Mm-hmm. But there are some other characteristic clinical symptoms that can also make primary care doctors lead them to, okay, let's check the thyroid and see what's going on.
And the thyroid is tiny. It's small compared to other organs in the body and parts of the body, but it is really important, right?
Oh yeah, the thyroid is a small gland that locates right here on your neck, and it has a lot of functionality in terms of the metabolism of your body. It controls the thyroid hormones that are going to affect a lot of things in your body.
Mm-hmm. And education is key when it comes to your health, and so you have a great presentation for us, so let's get started.
Yeah, absolutely. Okay, so we're going to talk about the thyroid. So what is the thyroid? So we need to know that the thyroid is like a small butterfly-shaped gland located at the front of the neck that produces hormones that is going to influence the body's various functions. Now, the thyroid consists of the right and the left lobes, and they are both connected by a median isthmus that is anterior to the second and the fourth tracheal rings. Now, this is part of the endocrine system, and it plays a crucial role in circulating regulating the metabolism and the energy levels. Now, what is a thyroid disease? So when we talk about thyroid disease, we like to basically divide them on like two big categories, which is a functional problems and structural problems. Now, functional problems, we can include the hypothyroidism, or some people refer it as underactive thyroid, and the hyperthyroidism, or some people refer it as overactive thyroid. And the structural thyroid disease, which include the thyroid nodules, we will talk about it, and the goiters, which we have like multinodular goiter, diffuse goiter, and the last but not least, the thyroid cancer. Now, we know that by the American Thyroid Association, like Tom said before, an estimated of 20 million Americans have some form of thyroid disease. And with that 60% of them, they are not aware of this condition. Now, what are the symptoms? Because many people at home know that, so how can I know whether I'm having a thyroid issue or I'm not? So if we look at the big categories, hypo and hyper, hypothyroidism is going to make people more fatigued. It's going to make people gain weight, increase the blood cholesterol levels, increase the sensitivity to cold, more constipation, dry skin, puffy face, hoarseness, and irregular menstrual periods, and dry hair or hair loss. Versus hyperthyroidism, if we compare, is the opposite. Some people might have some prominent eyes, some irregular or rapid heartbeat, increase on the blood pressure, some shaking hands, increase in sweating, hot flashes, irritability, and increased bowel movements, as well as weight loss. Remember the hypo, I told you it was weight gain. This one will be weight loss. And brittle hair and hair loss as well. Now, how is the thyroid disease diagnosed? First and foremost, we started with a good physical exam. So your health provider will feel your thyroid gland to check if it is enlarged for nodules. So when you go to your doctor, you're going to find that the health provider comes behind you or like from the front, and they ask you to swallow. What we're trying to do is actually palpate your thyroid gland and see if it is increased in size or if we can feel something different on the surface. And the second most common thing is that we do blood tests. So in the blood test, we can tell whether a patient has a hypothyroidism or hyperthyroidism. The usual tests that we order are the TSH, or the thyroid stimulant hormone, the T3, T4, and the thyroid antibodies if it's necessary. You got to think about the thyroid as like, it comes a signal from the brain, it comes to the thyroid, and it tells our thyroid, depending on the body demands, whether to release more or less. And when there is a problem with that, that's when we have these conditions. Now, some imaging tests that helps us, know about if we feel any nodule. We need to go deeper on trying to see what's going on. And some of the tests that we order are ultrasounds and nuclear medicine imaging. Now, what are the effects of thyroid disease? Some people can have like atrial fibrillation. This can lead to strokes, congestive heart failure, osteoporosis, mood disorders, peripheral neuropathy, and infertility. Now, many people are always concerned when their primary care provider find nodules, and they are concerned whether these can be cancer or not. We gotta think about that most thyroid nodules do not cause any symptoms. And actually, they are discovered incidentally during a routine physical examination or on imaging test that was done for anything else. For example, some people we have to do some ultrasounds of the neck or CT scans of the neck for different reasons, and that's when we find the nodules. Now, by the age of 60, about 1/2 of the people have a thyroid nodule that can be found either through examination or imaging. But fortunately, and this is one thing that we always emphasize to the patient, 90% of those nodules are benign, meaning that they are not cancerous. However, the thyroid ultrasound is a key tool for thyroid nodule evaluation. And depending on the characteristics of the nodules, when we see it on the ultrasound, we either need to do a tiny we call it fine needle aspiration, where we go in with the help of the ultrasound, and we aspirate a little bit of the thyroid nodule, and then we send it to pathology to see what it is exactly. Now, the risk of overlooking a cancer when a biopsy is benign is generally like less than 3 in 100 tests, so 3%. And a malignant result, which is what will worry majority of the population for these nodules, is like about 55% of the biopsies. Now, what are the warning signs? If you start, seeing like swelling on your legs or face, obviously not all of this is just thyroid, it can be other things, but if you start feeling that, it's time to go seek medical attention, and sooner rather than later. If you feel like there is like weight changes, like temperature sensitivity, you feel more cold than usual, not like right now it's very freezing, but like more cold than usual, or more hot than usual. You start having like hair loss, brain fog, mood changes, trembling, sleep changes or fatigue, vision problems, and gastrointestinal issues, it's time to see your doctor. Now, what are the treatment options? So the treatment depends on the type of condition. If we have a patient that has hypothyroidism, of course, the treatment is replacement of the hormone. If we have a patient that it is hyper, then we use different medications like beta blockers and some other medications. If it's needed, some people might need a radiodiodine therapy for also these issues. And in very occasional cases, we might need surgery. And if surgery is needed to remove the gland, then the patient will need a replacement for life. Now, what are the prevention tips? So my clinic, it says that most cases of thyroid disease are linked to genetics and are caused by autoimmune conditions, which it cannot be prevented. Now, thyroid conditions can be prevented, are linked to iodine deficiency or excess iodine, which we don't see much here in the US, but that's another thing to to be aware of. And being aware and knowing that what to look for, it can help a person to spot thyroid issues early and make it easier to get a target treatment, which can relieve symptoms and also improve an overall well-being. That's all I have.
There is a lot to know about the thyroid. As you do the research and you look into it, you see that it is a really important gland. So let's talk about some of the ways that it affects the body. So keeping the body's temperature at a normal level. So that's really important, especially when you're dealing, temperature and your body's temperature, especially when you're dealing with things like fevers and things like that. You want to make sure that your temperature is at a normal level. And so if your thyroid isn't working properly, that's a big issue.
Yeah, because some people can report to us like, oh, I'm feeling so hot, I don't know what's going on, and it can be a man, and for a women sometimes they can say like, oh, it might be the hot flashes from menopause, but it can be a man and having the symptoms, and is different from what their normal baseline is.
And then you talk about it supports normal growth and cell turnover. It maintains a normal heart rate. So these are sort of, when you hear about this, burning calories in regular and unexpected fashion, maintaining bone breakdown and reabsorption. But two of those are really concerning because, as you mentioned, the body temperature, you may confuse it with a hot flash. If you just think, oh, I'm just having a hot flash. And with the maintaining a normal heart rate, that's really important because you may confuse it with something that could be considered heart disease or something like that. So it's really important to be speaking your doctor, right? With your doctor and seeing them often.
Yes, it's very important, and it's very important to get your labs done and follow up on them. I mean, even if you go to the doctor and get labs, always try to follow up on your results. And it's good to be proactive as a patient as well, to just know about it. So the earlier you catch it, the better options you have.
Mm-hmm. Now, when you talked about all of the different types, are there two that are the most common? Would that be the hyper and hypothyroidism?
Correct. Correct. Yeah, hyper and hypothyroidism are the most common. Now, on those we have, the hypo. The most common condition is Hashimoto's, actually, which is an autoimmune disease and then we find this a lot, usually on young females, but not all of them have to be young females. But that's where we find it. And then in the hyper, the most common is called Graves' disease, which is another thyroid issue. And then the most, like serious condition from this will be a thyroid toxicosis, which is like all of the thyroid hormones are very high up, and then people can be really, really sick and be on the ICU, and they need emergent treatment.
Yeah. So with the two more common ones, the hypo and hyper, you're talking about underactive and overactive. So when it comes to treating them, are there similar treatment options, or does it vary drastically when you're dealing with that?
No, I mean, for the hypo, which is the hypothyroidism, which is the underactive, we treat them with the hormone, which is the levothyroxine, which is like very similar to your like your thyroid hormone, and that's how. And then we check them very often in the beginning because we have to manage the dose, and it's very important for the people to come to the doctor, especially in the first few months when we are trying to figure out what dose works for you and maintain the levels stable. So that's for the hypo. Now, however, for the hyper, depends on your symptoms. We use some medications called beta blockers that help, because in the hyper people feel like their heart is a lot of palpitations, and beta blockers actually decrease the heart rate, which helps with those symptoms, and helps also decrease the conversion of the thyroid hormones as well. And then we usually use other medications that are also to decrease the thyroid itself, like metamizole or PTU, propionate as well. So different medications for both.
Now, who is most at risk for thyroid health issues?
Well, family history has a lot to do. If you have something in the family as well, there are like many, the men syndromes that, also if there is like a thyroid cancer in the family, or there like, something with the parathyroid as well. I mean, there are pheochromocytomas, which are called the men syndromes that we have various subtypes. Those are people that are at risk. People who have worked also with radiation, but not radiation, but like on radioactive, I should say, like nuclear and stuff like that, they are also at risk. But in general, it's good to always check your thyroid function for everybody, because we need to know that everything is going well. Now,
you did talk about those symptoms, and I think it's really important for the audience that's watching just to make sure that they understand what to look out for. So we're talking about that slower than usual heart rate, or that accelerated heart rate, right, depending on the type of thyroid issue you're feeling. Feeling tired and fatigue. That's one thing that I think a lot of people may just think, oh, I'm not getting enough sleep, but there may be something having to do with your thyroid health if you're experiencing that often, even though you're going to bed at a decent hour and getting restful sleep.
Correct. And I'm glad that you mentioned that, because fatigue, sometimes we blame it on other things, but sometimes it can be a health issue, and it can be discovered with just like a blood test, like we said before.
And then that unexplained weight loss or weight gain. So you're working out, or you're not working out, right? Or you're doing whatever, and you're noticing differences in your weight that you shouldn't be seeing. That's a red flag that we should be paying attention to for our health in general, right?
Yeah, correct. Because in like the hypo, people gain a lot of weight like quickly, and it's more than the ordinary. Many people say but I'm not eating that much, and it's true. And then for the hyper, some people are losing a lot of weight without trying. So those are things that you need to always keep in mind and seek medical attention.
And the feeling sensitive to cold. So I know that we're dealing with a bit of a cold front that we've received, an Arctic front, it feels like. But that sensation of cold, even when you're not necessarily in a cold room.
Correct. So when we say like the cold symptoms, is like People can be on the 90-degree weather and they are freezing. There is no way for them to get warm. So that's different, because nobody should feel like that. If you're in a 90-degree weather, you should be hot. And if you're cold, then there is something going on. And the same goes with the hyper. People are hot all the time, and then they go outside and then they are extremely hot.
And then we also have the dry skin and dry and coarse hair, why does it affect the hair and skin in that way?
Because it's mostly metabolism and dealing with the cells itself. So it makes everything like changing, all of the electrolytes and everything and whatnot.
So pay very close attention to those symptoms. If you experience any of those, it's definitely time to be talking to your doctor. Do you recommend, I know that it's a lot to think about, we lead busy lives, but keeping sort of a journal of, today I was feeling this and this, so that way you can kind of see a pattern maybe that you can have that better conversation with your doctor?
Yeah, actually, that's a good point that you have, Tom, because that's something that we are recommending our patients, and usually we tell them, like I'm rotating cardiology, Dr. George always tells his patients, keep a notebook. And the reason of the notebook is because when you write it on just a paper, that paper gets lost. When you have a notebook, it makes you more organized, and then you can keep a track of your symptoms, and the next time you come to the doctor, you bring the notebook, and everything should be there. So if it's anything, you're like, oh, let me look at, and then you can show us, and we can help you look through everything.
Now let's talk a little bit about the thyroid and the heart. So thyroid hormones can definitely impact the heart function, right?
Yes, definitely, because it affects the metabolisms, and when it affects the metabolism, it affects the cells on all of your body. So it can have your heart have irregularities. Instead of the heart like contracting as it should, then it start having like irregular beats, and why not?
So too much thyroid hormone can increase the risk of atrial fibrillation. What is atrial fibrillation?
So when you think about like atrial fibrillation, you gotta think about like the heart is like 4 chambers. So we have the atriums like in the top, and then we have the ventricles on the bottom. Atrial fibrillation, and then normally it contracts like this and then contracts down. I mean, obviously it's one big contraction, but if you divide it, it's kind of like that. And when we have atrial fibrillation, the atria that usually gives the impulse, starts the impulse, the electrical impulse, does this. It quivers.
Okay.
So it quivers and then it contracts. It quivers and then it contracts. Now that quivering is what makes the flow of the blood actually be like turbulent, which can create blood clots, and those blood clots can travel. And that's why we always say, like, if you have atrial fibrillation, you need to see the cardiologist, because we need to regulate the rate, we need to regulate the rhythm of your heart.
And over time, that irregular heartbeat affects the function of the heart, so that puts you prone to other issues related to the heart, and those blood clots can lead to stroke.
Correct.
So that's why it's really important to see your doctor right away. If you're starting to see any of those symptoms, you experience them, those warning signs, especially because your heart is necessary for life. Like, you need your heart to beat. Yeah. And so if you're not taking care of your heart and issues that may affect your heart, you're in big trouble.
Oh yeah, absolutely. Yeah, if you start feeling palpitations, or you feel like, you're pounding, or things that doesn't feel normal, people will come and they will tell us, like, this doesn't feel normal, my heart is palpitating differently. Then please come and see your doctor right away, because the doctor can listen to you, it's very easy for us to put a stethoscope and try to hear, are there any murmurs, are there anything else that we can hear, and then refer you to the specialist as appropriate.
But it isn't just the heart. We're also talking about osteoporosis. You're more at risk for osteoporosis, which you hear about it when people, as they get older, that they're maybe a little more prone to that. But you can definitely experience those issues.
Oh yeah, if you have problems with your thyroid, yes, you are more prone to your bones actually to lose calcium, because it goes, like I said, it goes in the whole body. It has to do with the regulation of other hormones as well. So it will give you osteoporosis.
Mm-hmm. And we've talked about the physical, but we're also talking about mental health issues that can also, so you can experience depression because it does stabilize your mood. So you can be dealing with issues like depression.
Yeah. Like usually, you know, with hypothyroidism, you might deal with depression, versus with a hyperthyroidism make you feel a little bit more anxious.
So anxiety, depression, all of those can be impacted, which is really important. What is the common? Did you find that a lot when you were dealing with the patients at the clinic? Were you seeing a lot of mental health issues that they were also dealing with because of not just the physical?
Yes, actually, you know, when I was training with Dr. Ginas, that was one of the things he was always making me look into it, and like asking the patients, they will tell you, and it's like, oh, so let me know. So, and then we will look at the labs and we will see how everything is balanced.
Mm-hmm. So a patient comes in, they have the symptoms, and so you're going to do testing. You're obviously doing the physical testing, checking the neck, but once it gets to the blood tests and gets to the imaging tests, tell us a little bit about that process. Like, because I know people get a little afraid of needles, they get afraid of having to go maybe into a CT scan or whatever, but for the most part, it would be a simple blood test?
Yep. So for the most part, it will be a physical exam. We're going to palpate the thyroid. That's not going to hurt. You know, we ask you to swallow. It's just to, you know, palpate it and see how it is. And then after that, we will do a blood test. So it will be just one tube of blood and nothing more. I know they are afraid of needles, but that's all because with one blood test, we can check all of the hormones.
Mm-hmm. And then for the ultrasound, that's a very easy exam. They basically run the ultrasound over the neck and are able to get a good reading from that.
Oh yeah, so, and then, you know, if we feel like we need an ultrasound, depending on the results of the blood test as well, then we do an ultrasound. And it's like, you know, like I tell people, like when you were pregnant, you know, the ultrasounds, but now this time we put the gel on the neck, and then we are just looking for the lobules and the isthmus, and we're looking for any nodules that seem different. Mm-hmm. Because like I told you, like most of the nodules are benign, mm-hmm. but we gotta look at them.
Mm-hmm. And then would you ever require a further imaging testing? Would you ever have to get an MRI or a CT scan once you get past that ultrasound phase?
Well, for some people with hyperthyroidism, some of them, you know, they have multiple nodules, so they can have a goiter as well. So some of them, we might require a nuclear test. Actually, it's called a RIO. So, and that's a different test, and that's because we're testing those nodules to see whether are underactive, hyperactive, and then that leads us to different diagnoses as well.
Mm-hmm. Now, is it true that the thyroid stimulating hormone, the TSH blood test, is really accurate? Like that is your go-to test for thyroidism?
I mean, it is in conjunction with the other ones.
Okay.
I mean, we're always looking at the TSH to see the regulation, but we have to see the T4 and we have to see the T3. And we're trying to, because, you know, TSH is basically the hormone that is going to say like more T4, less T4, depending on the body's needs. But we have to look at all of them. I mean, TSH is a good test, but we have to in conjunction with the other two.
With the others. And then when it comes to treating it, are the treatments very invasive? It's in the beginning stages, you've caught it early. Are there some simple medications that you can take, or can it be a more progressive treatment?
Depends. I mean, if it is hypothyroidism, usually it's just replacement of the hormone, okay. And it's just one pill. And we always tell in the clinic to the patients, please take your thyroid medications. The first thing, if it is the levothyroxine specifically, or some people know it as Synthroid, which mm-hmm. is a commercial name, take it first thing in the morning. 30 minutes before you eat or drink anything. Your stomach has to be empty because the absorption of that hormone differs whether you have eaten or not. So that's super important because that is gonna, you know, tell us the levels later on. But that is the most important for that, and then that's just a medication. And with a hyperthyroidism, you know, it's the same. It's just medications to try to regulate it. Usually, it doesn't go further unless you have, you know, nodules or like, you know, the goiter, or you have hoarseness, and then, you know, we might need more invasive things to do.
Now, we always talk about the importance of eating a balanced diet and our nutrition and taking a look at what we put into our bodies. How does our diet impact our thyroid?
Well, so far it's kind of hard to tell, but in general, we always say, like, you know, try to eat a balanced diet. I mean, it's just for everything, you know, like try to eat more like white meats, like chicken, fish, vegetables, and also, you know, exercise. Exercise is gonna do a lot for people, and I always tell the patients, you know, you don't have to run the Boston Marathon tomorrow. That's not our purpose.
I really wanted to.
That's not our purpose. But what we want is at the end to achieve 30 minutes of aerobic exercise daily, okay? And that's gonna go a long way because it's gonna help all of your general, you know, health and get better.
In general, you're supposed to be getting about 150 minutes of moderate intensity aerobic exercise. So getting your heart rate up to about a 5, between a 1 and a 10 is what they say. So at that 5 level where you're a little bit out of breath, but you can still have a conversation with the person. So that can just be a brisk walk around the block. There's a lot that you can do, and you can divide up that time in your week. So you're never too busy to take a walk around the neighborhood, right?
Absolutely. I always tell people, let's start with 5 to 10 minutes. Let's start. You know, that's a start. And then every 2 weeks you increase it. 5 minutes more. Every 2 weeks you increase it. Now 5 minutes more until you get to your target of 30 minutes daily. That way you get used to it. It's kind of like, you know, when we get used to have the coffee in the morning. Yes. So that's a new habit. It becomes a habit.
21 days, right, is when it becomes a habit after 21 consecutive days. So just make it a habit, 21 days. And if you want to really take the challenge, go walk tonight in this cold weather. You're going to walk really fast. You're going to get 10 minutes worth in 30 minutes would have been. You're going to be really fast.
yeah, probably. But take it easy. We don't want, like, if you're having some other issues, we don't want you. I'm rotating at the heart hospital, so
yes, we don't want to see you tomorrow at the heart hospital. Now, let's some tips for a healthy thyroid. So, trying to limit ultra processed foods. I think we forget how dangerous those processed foods are.
Yeah, you know, unfortunately, you know, many foods now that we consume, they have all of these hormones, extra hormones.
And then the additives and the preservatives
yes.
to keep them on the shelf longer, which unfortunately doesn't keep us on the shelf longer.
Absolutely, no, it's gonna affect us. And then, you know, the sodium. I mean, many of these foods that now we consume has like high amounts of sodium, and that actually creates issues in the long run.
Another tip, get enough iron in your diet. How important is iron?
Iron is super important because if you are anemic, you're going to be feeling fatigue, you're going to have the brittle nails, and it's going to confuse it with the thyroid. So it's very important. I always say, like, just a balanced diet.
A good balanced diet.
Not too much of few things, not too little of others. Like, always imagine your plate divided like on 3. You know, like you divide it on half. Half of your plate should be your veggies, any kind of veggies, any greens that you like. And the other half, you're going to divide it on half. So that third should be your protein, chicken, fish, meat if you like, but limit. And then the other third, it should be your carbs. So that includes your potatoes, your tortillas, your bread, but that's the way your plate should look.
But your plate, half of your plate should be fruits and vegetables.
Not
meat,
Not meat.
and not carbs.
No.
The other half is a split between the carbs and the meat.
Correct.
And I think that's what happens. Portion sizes, unfortunately, are out of control. You go to a restaurant and it's basically like 2 plates for one a lot. So just making sure that you're paying attention to your portions as well.
Yes, very, very important, because sometimes, we all run a busy life, but we gotta pay attention what we put on our body because it's gonna affect you in the long run. So just be conscious about what you have. There are gonna be cheat days, but try it as much as you can. Like be conscious on what you consume and what you put in your body.
Mm-hmm. Now, the Cleveland Clinic recommends the selenium as a supplement that you can use. Have you ever heard about using the selenium supplement?
Not much, though, honestly. Selenium is, another mineral vitamins that we all need, but I haven't heard too much about it.
Yeah, because it says that it's a mineral that your body requires to activate thyroid hormones. So apparently studies have linked low selenium levels with increased risks for chronic autoimmune thyroiditis, Graves' disease, and goiter. So I guess the Cleveland Clinic says a selenium supplement might be helpful. Now, let's talk about the link between obesity and thyroid issues. Do you see that there's a really a very particular correlation between them?
If you have hypothyroidism, that makes you increase weight, and some people can be obese and they don't know that they have a thyroid issue. So that could be a link in between the two. And unfortunately, obesity, having more fat tissue and stuff like that, it actually, some people might get also diabetes and some other problems as well.
Now, research has shown that thyroid problems are highly likely during pregnancy and menopause. So I think that's probably really important if you are planning to get pregnant or are pregnant to be paying attention to your thyroid, right?
Yeah, especially, if you have thyroid issues, it's very important to you let's say you're taking levothyroxine as medication. It's very important that you let your doctor know that you're planning on getting pregnant, because we have to adjust the doses as the trimesters go. We have to increase, we have to decrease, so we have to really manage very closely. So that's something that is always recommended.
And then if you're going through menopause, then that's another time that you also need to be paying attention to your thyroid, because you'll be regulating, especially for the temperature, because as you get hot flashes with menopause.
Yeah, menopause gives you hot flashes, but sometimes, you might be carrying some thyroid issues as well. Then many people also, have, during menopause, you have menstrual irregularities, but sometimes you might have also a thyroid issue behind as well.
Now, we always talk about, one of the other things that I think we don't really pay attention to when it comes to good health is getting sufficient sleep and getting the 7 to 9 hours. Does the lack of sleep impact your thyroid?
I wouldn't say it impacts your thyroid per se, but it impacts your body completely, because now you're not getting enough sleep, you're not letting your body rest, you're now in this hype trying to I don't know, and then you're tired later on, and it's gonna affect your health. And many people, they can feel that. So
prioritize your sleep. Get the 7 to 9 hours that are recommended for adults.
Yes.
And then when it comes to stress, does stress impact your thyroid?
It wouldn't impact directly your thyroid, but if you're having hyper, you might be anxious and you might be more on the edge, more than the rest of the population.
Now, 1 in 8 women will develop thyroid problems likely after pregnancy, is what research shows. So it's really important if you've had children to make sure that you're seeing your doctor, that you're paying attention to your thyroid health.
Correct. That's why it's important to go to your doctor at least once a year, because then the doctor, what we will do is actually check everything, all of your labs, from your blood cells to your thyroid. We will check your liver, cholesterol, everything. So it's a good time to find out. Preventive medicine is the best medicine.
making sure you're getting to the doctor. How often should you be going to see your doctor? Once a year is usually the case, right?
I will say once a year at least.
At least.
And then depending on your conditions, depending on your problems, you might need it to be seen a little bit sooner, follow up a little
6
sooner.
months, every 3 months,
Correct.
depending on if you're dealing with any condition.
Yes, correct.
Now, when should you see your doctor? Are there any telltale signs where you're like, okay, definitely go and see your doctor right away, or go to an ER when it comes to the thyroid? Is there anything that you would say this is a warning sign that you really need to go today?
I mean, in general, like if you're starting having like the palpitations, or you're starting having like, fatigue and like, falling asleep on like while you're driving, things that are not normal, I will always say, like, seek medical attention sooner rather than later, because there are many things that we can just see with a blood test and with the help of a blood test, or with a good physical exam. Like, physical exam tells us a lot. You will never believe it, but a good physical exam goes a long way.
And your final piece of advice for anyone who's out there watching when it comes to their thyroid health, what would you want to tell them?
I would say just, follow up with your doctor at least annually, and they will run tests about your thyroid function. So they will run at least a TSH, a T4, just to see how everything is going. And then, if it's something that needs to be taken care of, we will do further studies and evaluate you and get you the treatment you need, like sooner rather than later. And then if you have a thyroid nodule, we will, see what it is, and then refer you to the correct doctor if it's needed, and work it up that way.
Do you check the thyroid at every visit?
In an annual physical, yes. And
Okay.
if you come with symptoms, you're telling me, I feel more hoarse, I feel like I can't swallow something, then for sure. But most likely, majority of us would check it.
Alrighty, well, thank you so much for your time. We really appreciate it.
Thank you for having me.
And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, February 18th from 5:30 to 6:30 p.m. when we discuss heart failure. Like and follow the South Texas Health System Facebook page for more details on future Let's Talk webinars. And if you'd like to see our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health. At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.